And good morning, I'm Carol Costello. Thank you so much for joining me. We begin with breaking news and rattled nerves in New York City. This morning, an American doctor is hospitalized in isolation, battling the first case of Ebola to crop up in the nation's most crowded city. 33-year-old Craig Spencer had been treating Ebola patients in West Africa. He returned to the United States 1 week ago today. He had cleared enhanced screening for Ebola at New York's JFK airport. That's because his symptoms did not appear until 6 days later, just yesterday. His fever spiked. He was rushed to Bellevue Hospital, one of the medical facilities designated by the state to handle Ebola cases. Today, 3 people who came into contact with Spencer are in quarantine because they dealt with him when he was sick. And doctors say Spencer posed no threat when he visited a bowling alley or rode the subway. Also new this morning, researchers may be getting closer to a vaccine against Ebola. Clinical trials will soon begin for 5 experimental vaccines, and it's possible a mass inoculation program could be launched by the middle of next year.
I don't know exactly how much vaccine will be available in 2015, but it will be in 2015. That's absolutely for sure.
We're covering all angles of this story. CNN's Elizabeth Cohen is outside Bellevue Hospital, where Dr. Spencer is now undergoing treatment. And here with me is Dr. Devi. She's an assistant professor of anesthesiology and rehabilitation at the NYU School of Medicine. Welcome to both of you. Thanks for being here. Elizabeth, how is Dr. Spencer doing?
You know, we were told last night by Mayor de Blasio that he is in good shape. He didn't give any more details than that. We're expecting a press conference, Carol, an hour from now, where hopefully they'll give us more details. You know, 2 of the big questions are, is Dr. Spencer getting a blood transfusion from an Ebola survivor? Many experts think that that could be very, very helpful. And also, is he getting any experimental drugs? We know the drug ZMapp is not available. However, there are other drugs that Ebola patients have been getting, and there's some hope that those might work. Carol?
Elizabeth, the CDC team is already on site. What are they doing?
You know, they sort of have a dual role here. The first part is in the community. They want to make sure that all the contact tracing has been done right and that they have caught everyone who might have had contact with Dr. Spencer. They're also going to be going inside this hospital right here and trying to see, making sure that they're observing good infection control practices, wearing the right protective gear. This was obviously a big issue in Dallas. It is not expected to be a big issue here. This is a hospital that has trained for this. It is designated to treat Ebola patients. You know, the CDC folks are here, but I will say New York City has an incredible public health team. This is a different situation than in Dallas. The CDC is here to support the New York team that's already here.
Okay, Dr. Devi, now I want to calm some fear because there is a lot of consternation here in New York City this morning, right? So I guess my first question, and I'll ask you this because a congressman brought it up. He said this doctor should have been in quarantine for 21 days since he came back from West Africa. Instead, the doctor passed through the airport after being checked, right? Yeah. And he went home, and when he showed signs of a fever, he called an ambulance and then was taken to Bellevue Hospital. Should he have been in quarantine for 21 days?
I think he should, but I think that there should have been more clear guidelines to anybody coming from West Africa about the quarantine period. So, for example, here, you know, he was checking his temperature twice a day, so he was trying to be vigilant, and he didn't go directly to the ER, you know, on his own. He actually alerted people, the first responders, that he was at risk for Ebola, so at least he took some precautions. But in terms of going out to the bowling alley and other things, using the subway, I mean, that is a concern. So we need to really be consistent in our approach. We need to tell people what to do. And I think,
so just to make it clear, so the doctor, in your mind, should have stayed at home for 21 days?
Well, I think he should, but it's a judgment call, right? He wasn't told to do that. He wasn't told that he was absolutely in quarantine. So I think we have to be more clear, you know, the CDC or travel officials about what people need to do coming back from West Africa.
On the other hand, we hear from doctors that it's not an airborne disease, and because he rode the subway and because he went bowling doesn't mean anyone's at any risk of catching Ebola. So you can see the confusing message there.
Well, I think there are 2 things. So they're not at risk in the sense that he didn't have any symptoms, and you're not contagious if you don't have symptoms. But in terms terms of just creating panic or making people alarmed, why go through that? So they may not be at risk for Ebola, but they still feel some concern because it raises all these questions. Well, what if someone was using the subway? What would we do in that case? I mean, I think we should have actually a strike team for the people in quarantine, because why do people leave quarantine? Because they can't get food, you know, they need to do things, they're kind of alone, maybe they have trouble at work trying to explain why they can't come out of their apartment or wherever else for 21 days. So I think there are a lot of things we could do better.
Interesting. And Elizabeth, 3 people came into close contact with Dr. Spencer. Where are they this morning?
We understand that they're being quarantined. We haven't been told an exact location yet, exactly where they are. You know, it may be in their own residences. You know, I want to add something to what the doctor just said. There is, you know, I think we're thinking of this as black and white a little bit. Should they be allowed out or should they be in quarantine? Is there a middle ground? I was just speaking with an expert who said maybe we should let them take that 3-mile jog, because you're not going to come in contact with someone on a 3-mile jog. But maybe they shouldn't be getting on the subway, because it's hard to avoid touching someone on a subway. I think that there are steps to this that have not been thought through, that the CDC is really just now thinking through.
All right, so Elizabeth Cohen, Dr. Devi, stand by, because I'm going to bring our viewers back to Capitol Hill, where there's a House Oversight Committee hearing on Ebola and how it affects healthcare workers, specifically nurses. Oh, I was expecting Dr. Lurie. This is the co-president of the National Nurses Union. So this is Ms. Berger, Deborah Berger. Let's listen.
The Ebola pandemic and the exposure of healthcare workers to Ebola in Texas and the real threat that it could occur elsewhere in the U.S. represent a clear and present danger to public health. Every RN who works in a healthcare facility could be Nina Pham or Amber Vinson, both of whom contracted Ebola while treating Thomas Eric Duncan at Texas Presbyterian Hospital in Dallas. 1 patient diagnosed and dead in this country, 2 nurses infected so far. We have called on President Obama to invoke his executive authority and urged Congress legislatively to mandate uniform, optimal national standards. These include full-body hazmat suits that meet the ASTM F1670 standard for blood penetration and the ASTM F1671 standard for viral penetration, which leaves no skin exposed or unprotected. NIOSH approved air-powered purifying respirators with an assigned protection factor of at least 50 or higher standard as appropriate. At least 2 direct care RNs for each Ebola patient and no additional patient care assignment. Continuous on-site interactive hands-on teaching with the RNs and updates responsive to the changing nature of the disease. The precautionary principle must be utilized.
We're going to jump out of this, but you get the gist of what she's saying. Common sense rules should be put into place, and a federal mandate should come from either the legislature or the president so that everybody is on the same page. Dr. Devi, it sounds like such common sense.
I agree. I'm not sure why we need legislation, because you would think that hospitals would actually want to be prepared to treat Ebola. Why have a repeat of what happened in Texas?
So why is it so difficult to come up with one set of guidelines to protect healthcare workers?
I think part of the issue is that we haven't faced this type of crisis before. We haven't seen something like Ebola, so people, they might not have taken it as seriously at first and thought that, well, we won't see a patient here with Ebola. And then there was a sense of overconfidence where they felt like no matter what, we'll be prepared, it's not a big deal. Well, now we've seen that both those approaches are not going to work. So I think it should be easier to get it done, but some of it may be practical considerations, just getting the actual gear or doing the training. But that's not an excuse.
Dr. Devi, many thanks to you.